read, there's this infinite number of medication rights. But the bottom line is that there are some basic ones that you have to know, right? So medication, dose, time, route, client, documentation, client education, the right to refuse, assessment, evaluation. So just be, sure that you understand that sometimes your calculation question may be a calculation question, but it might have to do with the 5 rights as well. So just kind of keep that in mind. I always like to include this slide when I'm teaching math, only because I find that some students have no problem doing the calculation, but they cannot do the conversion. And the conversion is an integral part of getting the right answer. So if you struggle with conversions, this is just a shortcut that I like. If you want to move the decimal, this is kind of a visual to help you figure out how to move the decimal. I personally don't move the decimal and I don't teach students to do it, only because if you don't move it enough spaces, then you end up with the wrong answer. I would prefer to teach students to multiply by 1,000 or divide by 1,000 based on which direction you want to go. So you're actually doing the math, you're not doing it in your head, and you're not moving the decimal. However, do whatever works for you. So remember, we're going to start with the base unit here in the middle. Units, grams, liters, sometimes meters. This tends to be our base. Okay, so of course, way over here, we have our kilograms, our kiloliters, and sorry, these are off. It should be kilograms, kiloliters. They're just not lined up right. Kilometers. So if we want to go that direction, we're going to be dividing by 1,000. If we want to go the opposite direction, which is where our milliunits, milligrams, milliliters, and micrograms are, we're going to be multiplying by 1,000. And then to go further to micrograms, we have to multiply by another 1,000. So do lots of practice with conversions. If you are not comfortable with conversions, you don't really understand how to move that decimal, how to do dividing by or multiplying by 1,000, this is a really nice video, a very basic video to walk you through the concept of conversions. Be sure you practice with conversions. If you would prefer just to memorize some conversions, of course you still have to be able to do the math, but these are the most common ones that you're likely to see really in practice and on NCLEX. So here's just a nice list for you if you want to know some of the more basic ones to learn. Okay, let's talk about some general rules. You're always going to have to do your conversion first, right? We're going to start by we're going to practice in just a little bit, but if what your provider orders and what is delivered from your pharmacy is not in the same unit of measure, whether that's volume or micrograms, grams, milliunits, micrograms, milligrams, grams, whatever, they have to be the same or you can't work with them. So you're always going to have to do your conversion first. Your provider order and what's available from your pharmacy is going to have to match in units of measure. Also keep in mind that it's the same way with minutes and hours. So if your order is a unit of measure to be delivered per minute, but yet your pump will only deliver it per hour, that doesn't match up. Likewise, if your order is per hour, but you're trying to do drops per minute, that doesn't match up. So everything has to match up in order for you to get the right answer. And we're going to do some practice. Okay, so volume. Anytime we use the word volume, that's a liquid. It can only be a liquid, right? So it's typically either liters or milliliters, or it could be teaspoons or tablespoons. But if you see the word volume, think liquid. Only conversions or math in liquid is what you're going to be able to have as your answer. Flow rate. If you see the word flow rate, that could mean milliliters per hour or drops per minute. If we're using an infusion pump, it's going to be milliliters per hour. Sometimes they'll use the word drop rate or gravity rate. That means drops per minute. Either way, milliliters per hour or drops per minute can only be a whole number. Now, we're not talking on NCLEX about fancy critical care pumps that can deliver, a tenth of a milliliter. Those are not the pumps that NCLEX is testing you on. Remember, this is entry-level knowledge. And for the purposes of NCLEX, you can only deliver a whole number on an infusion pump. So milliliters per hour, drops per minute, those are whole numbers. They're not going to tell you to round it to a whole number, most likely because they want you to know that it has to be a whole number. Watch for your wording. So sometimes your order will be a daily dose, but yet your concentration might be, your order might be per day, but what you want to administer is per dose. So really pay attention to that. Amoxicillin 800 milligrams POTID is a very different order than amoxicillin 800 milligrams daily in 3 divided doses. In one, you're giving 800 milligrams every time you give it. In the other, you're taking your 800, dividing it by 3, and that's what you're giving per dose. So really watch daily versus dose. Are you calculating a daily or a single dose? And then other pharm concepts to remember. Capsules, we can't break a capsule in half, right? Capsules have little beads inside, so you can't give a half a capsule. If it's an extended release tablet, you can't cut it in half, right? Because then you've destroyed the property of the medication. So just keep all those things in mind when you're working through your pharmacology questions. Okay, let's talk for just another minute about milliliters per hour and drops per minute. I want to give you the visual of drops per minute because many of you have probably never seen it in clinical. I barely remember it, and I've been a nurse for 25 years because in acute care settings, we tend to have smart pumps. Now, places like nursing homes, if you've been in those places, or maybe places that aren't fortunate enough to be able to afford smart pumps, maybe you have seen drops per minute, but typically we don't see it all that much. So I want to give you the visual of why your number has to be a whole number. So when you look at this drip chamber that I have on this picture right here, literally way back a long time ago, the way that we had to calculate that was literally watching drops fall through that drip chamber. And then you were regulating with your roller clamp until you got the right number of drops per minute. Nowadays, there's a dial on the tubing, so you can set the dial at 25 or 15 or 10 or 100, whatever you want your drop rate to be. But there is no quarter of a drop, half a drop, 75% of a drop. It's either a whole drop or it's not a drop. And then, of course, milliliters per hour, we're just talking about your basic smart pump, which is going to deliver a whole number. Okay, let's talk about what a question is going to look like. So first, you're going to have a prescription. And remember, NCLEX calls everything prescriptions. It doesn't matter if we're in the hospital or if we're at home. NCLEX always calls it a prescription. So in this example, we have a nurse caring for a client who has heart failure and a prescription for digoxin, 125 micrograms PO daily. That's our prescription. What is available is digoxin PO 0.25 milligrams per tablet. Now, sometimes that'll say available. Sometimes it'll say the concentration is. Sometimes it'll say on hand is. Sometimes it'll say from the pharmacy is. Digoxin PO 0.25 milligrams per tablet. It all means the same thing. It means that what you have available from your pharmacy on hand in the concentration is X, and then you have an order. Now, what you really quickly, hopefully, notice in this problem is that our order is in micrograms, but what we have available is in milligrams. In reality, it probably doesn't matter which conversion you do. I personally like to and teach students to convert to what's available because that's what you have to give, right? I have milligram tablets. So I'm going to take my order and I'm going to convert it to milligrams so that I'm working with what is actually available. Okay, so prescription and available. And then you're going to have a question, which is really important. How many tablets should the nurse administer per dose? Sometimes it might say, how many milligrams should you administer per dose? Sometimes it might say, how many tablets should you administer for the entire day? So the question is really important. And then, of course, follow your directions. Record your answer using 1 decimal place is the example I used in this one, but oftentimes you will have a rounding rule at the end. Okay, let's move into calculations. These are the most common calculations that you will see really in real life and tested. Now, are there others? Certainly, but these are going to be the 6 most common ones that if you really struggle with math, these are the ones I'm going to recommend that you focus on. And we're going to go through every one. So the first one is going to be dose ordered divided by dose on hand. So prescription divided by what's available equals the amount that you're going to give. Now, this answer is usually going to be tablets or capsules, but pay attention to what it's asking you. But typically, this is going to be a number of tablets or capsules. Dose ordered divided by dose on hand times volume. So now we have a prescription divided by what's available, but what's available is a volume. So your concentration is something like 125 milligrams in every 5 milliliters. So now your answer can only be volume. You have an order and you have a concentration, but your concentration is a liquid. Therefore, the way you administer it has to be liquid. You don't have capsules or tablets, you have liquid. So maybe you're giving it IV, or maybe you're giving it IM, or maybe you're giving it orally, but it's a liquid irregardless. Then you have total volume divided by time in hours. That's the way you're going to come up with milliliters per hour. So let's say your doctor wants to give 1,000 milliliters of IV fluid over 8 hours. And you're going to get, when you do the math, you're going to get 125 milliliters per hour that you're going to program into your pump. Now, sometimes you're given the total volume and it says your order is to run it at 125 milliliters per hour. And now the question is, how long is that bag going to last? So now you're going to take your total volume, divide it by your hourly rate, and you're going to get an infusion time. So in that same scenario, 1,000 milligrams divided by 125, that bag will last 8 hours. And then we also have total volume in milliliters divided by time in minutes. And then you're going to multiply that times your drop factor, and that's how we're going to get drops per minute. Again, probably not mostly used in practice, but we do still see it tested. So we'll talk about that one. The other one I'm going to talk a little bit about at the end is pediatric safe dose and critical care math. Okay, so let's get started. The first one we're going to look at is, so a nurse is caring for a client who has heart failure and a prescription for digoxin, 125 micrograms PO daily, and what's available is digoxin 0.25 milligram tablet. How many tablets should the nurse administer per dose? And so we know that we have to start with the conversion. We have to go from 125 micrograms to milligrams. And when you do that conversion, micrograms is a bigger number. Micrograms is a bigger number than milligrams. So we're going to divide by 1,000 because we're moving our decimal to the left. And now our order is for 0.125 milligrams. And then we're going to do 0.125 milligrams divided by 0.25 milligrams. And then we're going to give a half a tablet. I knew it was tablets because it asked me how many tablets. So if you're saying 0.5, awesome, you got it right. Let's try another one. I'm going to let you guys think through it for a minute, and then we'll talk about the answer. This is the same type of problem. Dose ordered divided by dose on hand is going to give us the number of pills to give.
Dr. Bonnie, some of them are putting 4. One person put 25.
Okay, so let's talk through that for a minute. Always make sure that your answer makes sense. So if you come up with 25 tablets to give the patient now, that doesn't really make sense. We would probably never ask a patient to take 25 tablets. Likewise, if your answer ends up that you want to give, 3,500 milliliters per hour. I'm not going to say in a burn patient, you might not give a lot of fluid, but think about for the scenario you were giving, does that make sense? So let's talk about this problem. First, we have an order, which is 1 gram, but our pharmacy provided milligram tablets. So we can't work with that. The first thing we have to do is a conversion. So we have to, 1 gram equals 1,000 milligrams. That's one you should really be able to do pretty quickly. 1 gram equals 1,000 milligrams. And if we divide that by 250, we get 4 tablets. So if you said 4, great job. Okay, let's look at this one. Okay, so we have an order in grams and we have available from the pharmacy milligrams. So we've got to do a conversion. Okay, so when we do our conversion, 800 milligrams divided by 200 is 4 capsules, but that's per dose. This question is asking you per day. So that's where you can get hung up. So be really careful about what the question is asking you. Is it a daily dose or a single dose? This one was asking you for the daily dose. So we're only going to give 4 capsules at one time, but in the course of a day, 3 times per day, we're going to give 12 capsules. Okay, let's look at this one. Somebody asked, how did I get 800? That's the conversion of 0.8 grams to milligrams. That was the previous problem. Okay, so let's look at this one. The prescription is tetracycline 2 grams daily, PO, in 4 divided doses every 6 hours. So right off the bat, you should notice that that's a different kind of order than what we've been looking at. So this is 2 grams daily, but we're going to give it in 4 divided doses every 6 hours. What we have available is 250 milligram capsules, and the question is how many capsules are we going to administer per dose? So we have to do a conversion. 2 grams is 2,000 milligrams. We're going to divide that by 250, and that gives us 8 tablets per day because 2 grams is a daily dose. Now we're going to take our 8 tablets and divide it by 4 because we have 4 divided doses. And now per dose is 2 tablets per day. So I just wanted to give you some examples of how the wording can get kind of tricky. You really have to understand what the prescription is and what the question is asking you. Okay, let's move on to some volume. So now we're going to use dose order divided by dose on hand times volume. Volume is liquid. So our prescription is for 25 milligrams of diphenhydramine twice a day. And they're telling us it's for poison ivy, which is kind of irrelevant because this is a math question. We don't really care why we're giving it. It's coming in 12.5 milligrams per 5 milliliters. Okay, so first and foremost, we don't need any conversions because our prescription is in milligrams and our available is in milligrams. So the way we're going to work this calculation is we're going to do 25 milligrams divided by 12.5 milligrams, but now we have to multiply times the volume. And this is where that's coming from. 12.5 milligrams in every 5 milliliters. So this little slash that you see does not mean divided by. It means that every 5 milliliters of this medication has 12.5 milligrams. So dose ordered divided by dose on hand times volume. Okay, let's look at this one. Or actually, let's take the last one we did one step further. So notice this question was asking how many milliliters will you administer per dose. This is the same problem, prescription and concentration, but now it's asking you how many teaspoons will the nurse administer per dose. So if you remember, we had 10 milliliters as our answer. 10 milliliters is going to be 2 teaspoons. And that's because we have to know that 5 milliliters equals 1 teaspoon. That's a conversion you just have to memorize. 5 milliliters, 1 teaspoon. So if I want to give 10 milliliters, that's going to be 2 teaspoons. Okay, you guys try this one. We're using the same formula. Dose ordered divided by dose on hand times volume. Okay, so we have a prescription for phenytoin, 250 milligrams. What's available is 25 milligrams in every 5 milliliters. We don't need a conversion. Awesome. So now we can just do 250 milligrams divided by 25 milligrams times 5 milliliters. It's going to be 50 milliliters. And that kind of that totally makes sense, right? Because this is medication we're giving in a gastrostomy tube. Okay, let's look at another one. See what you can do with this one. So dose ordered divided by dose on hand times volume. Our order, our prescription, and our available are in milli equivalent, so we don't need to do a conversion, which is awesome. That's nice. And 1 milliliter has 10 milli equivalent. This one's easy. 20 divided by 10 times 1, you're going to give 2 milliliters. Okay, let's move on. Let's do time, or milliliters per hour. So remember, the equation is total volume divided by time in hours is going to tell you how many milliliters per hour to set your infusion pump at. So our physician orders 250 milliliters. Doesn't really matter what the solution is. That's not the point of this question. We know that we have 2,500 milliliters and we want to give it over 24 hours. And the question says calculate the flow rate in milliliters per hour. So we're going to do 2,500 divided by 24 hours. Now notice it has to be hours because what we want is hours. So if this said, 825 minutes, you can't work with that. You're going to have to convert that to hours. But it says 24 hours. What we want is per hour. So we don't need a conversion. And our answer is going to be 104 milliliters per hour. Okay, let's try this one. So this one's a little trickier, right? So first and foremost, I want you to notice, and you already know this, that NCLEX questions are famous for giving us junk information that we don't need because they kind of want to know if you know that it's information you don't need. So let's look at this one. We have a prescription for 50, doesn't matter what we're giving, 50 milliliters over 30 minutes. But it also gave us a drop factor. So a lot of students think, oh, they must want me to do drops per minute. But if you look, it's actually asking you for milliliters per hour. So you really don't need this drop factor. It's just junk they want to know that you know you don't need. So this is the same kind of problem. We're going to do 50 milliliters. Now you have two options because what you have is 30 minutes. Well, what we want is per hour. This is minutes, this is hour. That doesn't work. So you can do 50 milliliters divided by 0.5 because 30 minutes is half of an hour. That works. That will give you 100 milliliters per hour. Or you can do 50 milliliters divided by 30 minutes, but now your infusion is in minutes, and then you can just multiply it by 60 minutes to convert it to an hourly rate. So anytime that you're working with minutes and what you want is hours, just multiply your final answer by 60, and that will take it from a minute rate to an hour rate. So either way, your choice. Now it's easy when it's 30 minutes. It gets a little harder when it's 15 minutes or 20 minutes or 45 minutes. But just remember, you can always do 50 divided by 15 minutes, then multiply it times 60 and get your answer. Okay, let's try this one. So we have total volume divided by 1.5 hours, because look, hours and hours, that matches up. Just going to give us 100 milliliters per hour. Okay, let's move on. Now we're going to do infusion time. So now we're going to take our total volume and we're going to divide it by an hourly rate that we were given. And that's going to tell us how long our infusion is going to run, which is important for nurses, right? We want to know how long is this bag going to last before I'm going to need to replace it. So we're going to start with the prescription, which is 100 milliliters. That's our total volume of D5W. Doesn't matter that it's D5W with 10 of K, that's irrelevant. It's total volume, which is 100 milliliters. Now, some students will want to do something with that 10 mill equivalent, but this is total volume. Volume is not milli equivalents. Volume is milliliters or liters. So 100 milliliters, and we are going where there's no conversion. And so now we're going to do 100 milliliters divided by 30 milliliters per hour. And that's going to give us 3.33. But 3.33 is not the same as 3 hours and 33 minutes. So we're going to need to take that one step further. And now what we're going to do is take our, now we know it's 3 hours, but it's that 0.33 that we need to convert to minutes. So we're just going to multiply that times 60. And now 3.33 is actually 3 hours and 20 minutes. So this 100 milliliter bag at 30 milliliters per hour is going to take 3 hours and 20 minutes to infuse. So you cannot stop here. This is not the answer. You have to take it one step further to 3 hours and 20 minutes. Okay, why is it 0.33? Because you already have your hours. You only have to figure out how many minutes is 0.33% of an hour. Because this is a decimal, right? A decimal times 100 is a percent. So it's 0.33 or 33% of an hour. And 20 minutes is 33% of an hour. Okay, let's look at this one. Our total volume is 100. That's what we want to administer. Doesn't matter that it's famotidine. We don't care. It's 100 milliliters. The pump is 200 milliliters per hour. And the infusion time is 30 minutes. 100 milliliters divided by 200 milliliters is 30 minutes. So when you set your pump at 200, it's only going to take 30 minutes for that 100 milliliters to run in. This is very common when we're giving things like antibiotics, IV piggybacks that are just like famotidine that are going to run a very short period of time. Okay, let's look at this one. So I saw somebody ask, could I also say a half an hour? Do whatever NCLEX tells you to do. If they tell you to report your answer in hours, yes, but if they tell you to report it in minutes, no. So we have a total volume of 1,000. Again, we don't care what it is. Divided by 83 milliliters per hour, going to give us 12 hours. It's going to take for that bag to infuse. Okay, let's look at this one. Hopefully you're getting quicker with these. Okay, now I want you to notice, again, you have to pay attention to what they're asking you. This one's a little bit different. It's the same equation, but what they're asking you is a little bit different. So we have a total volume, 250, and we have 125 milliliters per hour. But the question says, what time will the infusion be complete? So the answer is not 2 hours. The answer is 1530 in military time, right? It is going to take 2 hours for it to infuse. You're right. You did that part correctly. But it said the nurse hung the normal saline at 1330. What time will the infusion be complete? Not how many hours, what time. And so if we started it at 1330 and we add 2 hours, we're at 1530. So pay really close attention to what it's asking you. Okay, let's move on. Now we're going to do drops per minute. This is where we're going to take total volume, but now we're going to divide it by the time in minutes, right? Because what we want is per minute, not per hour. So we're going to do divided by time in minutes times our drop factor. Now your drop factor will be given to you for the most part in the problem. So here we have plasminate. Again, it doesn't matter what it is. 250 milliliters is our total volume. Our time is 2 hours. We can't work with hours. So how many minutes is 2 hours? 2 hours is 120 minutes. So 250 divided by 120 times 12 is going to give us 24.9. But what do we know about drops per minute? It has to be a whole number. So that's going to round to 25 drops per minute. So 250 divided by 150 times 12. Okay, let's look at another one. So here we have 50 milliliters total volume over 30 minutes. Well, now we don't have to convert it. Minutes. That matches. That's perfect. So now we're going to do 50 milliliters divided by 30 minutes times our drop factor, which is 10, gives us 17 drops per minute. So here we go. We have a total volume divided by time in minutes times a drop factor. Total volume is 150. Time is 1.5 hours. Can't work with hours. 1.5 hours is 90 minutes. 150 divided by 90 minutes times 60, which is our drop factor, 100 drops per minute. Okay, any questions up until this point? Okay, let's do critical care. Critical care is where your order is going to be milligrams, micrograms, grams, some unit of measure, oftentimes per patient weight, and it's going to be ordered per minute. So sometimes your orders look like maybe you want to give, I don't know, nitroprusside, 10 micrograms per kilogram per minute. But the problem is we can't give anything per minute. Our pumps are milliliters per hour. So we have to convert that into a milliliter per hour rate. This is the formula we're going to use. We're going to do amount of the drug ordered. So, and we'll look at some examples. Times our patient weight. Now our weight is always in kilograms. In the healthcare world, we don't do anything in pounds. Forget pounds. It's always kilograms, kilograms. Times 60 minutes, because remember, it was ordered in minutes, but we have to convert it to an hourly rate. And then we're going to divide it by our drug concentration. So let's look at what that looks like. So our order is our patient is 65 kilograms. Now, a lot of times the question will say your patient weighs 180 pounds, and they're going to make you do the first step, which is to convert your weight. But in this one, we don't have to do a conversion. So we have 65 kilogram patient. Dopamine is ordered at 6 micrograms per kilogram per minute. So there's our prescription. And our IV, so what's available, is 400 milligrams of dopamine and 250 milliliters. And it wants to know what's the IV rate, which is milliliters per hour, right? So the first step is we have to convert. I like to convert to what my concentration is. So, but you can certainly go the other direction, and I'm going to show you that in this problem. If you want to go the other direction, you can. It doesn't really matter as long as your units of measure match. So our order or our conversion. So we're going to go from 400 milligrams. This time we're going to go to micrograms since that's what our provider ordered. So if we want to go for 400 milligrams, micrograms is a bigger number, so we're going to multiply times 1,000. Now we get this really big number. I don't like to work with big numbers, but we're going to do it in this problem so you can see that it works. So now you have 400,000 micrograms is your concentration. Because micrograms is our order, all we did was convert this 400 milligrams to micrograms. We don't have to convert our weight because that wasn't necessary. So now our rate is 6 times our weight, which is 65, times 60 minutes. Don't forget your 60 minutes because your order is in minutes, but what you want to give is in hours. So you're going to do 6 times 65 times 60, and you're going to divide it by 400,000 micrograms, and then multiply that number times 250 because this is your concentration. Right? Your concentration was 400 milligrams in 250 milliliters, and you had to do a conversion. You either had to take your order to milligrams or your concentration to micrograms. It really doesn't matter which way as long as they match. And then you have to add your volume. So the answer you're going to get is 14.6, but this is milliliters per hour, so we can't work with 0.6. So that is going to round up to 15 milliliters per hour. So this critical care calculation seems to always confuse students when I teach it. So we're going to try a couple of examples, but really if you can wrap your head around what's going on, it's really not any harder than what we've been doing. It's just it's a few more numbers. Let's look at this one. So now we have a nitroprusside drip at 0.4 micrograms per kilogram per minute. The concentration is 50 milligrams nitroprusside in 250 milliliters. Patient weighs 80 kilograms, and we have to set our IV rate, so milliliters per hour. So we can't work with micrograms in our order and milligrams in our concentration. You can convert whichever way you want. It doesn't matter as long as they're the same. So if we want to go from milligrams to micrograms, we multiply times 1,000. Micrograms is always a bigger number than milligrams, so you multiply times 1,000. That gives us 50,000 micrograms in 250 milliliters. That's our concentration now. We don't have to convert the weight because it's already done for us. And here's what our problem looks like. 0.4, which is your order, 80, which is your weight. Always have to multiply times 60 to go from minutes to hours. And we're going to divide by 50,000. And then we're going to multiply that number that we get times 250. What we're going to get is 9.6. Has to be a whole number. So that's going to round up to 10 milliliters per hour. Okay, let's look at another one. So Jennifer asked, I saw that, sorry, is the rate always in hours? If it's asking you to put it in an infusion pump, yes, that's milliliters per hour. Okay, so right off the bat, what you notice about this one is your order is not based on the weight. Okay, so we're not going to have that part of our equation. This time it's just ordered 1 milligram per minute. But what the pharmacy sent us was 2 grams of lidocaine in 500 milliliters. Okay, so I can't work with milligrams on one side and grams on the other. So I got to do a conversion. You can convert it however you want. So I just converted the grams to milligrams. So now you have 1 as your order times 60 minutes, because we're still putting this on a smart pump. We have to do milliliters per hour. So we've got to go to minutes. There's just no weight this time. And we're going to divide that by 2,000 milligrams because that's the conversion of our concentration times 500 milliliters. And that's going to give us 15 milliliters per hour. So really, if you look at this problem, what you're doing is dose ordered divided by dose on hand times volume. You're just having to also multiply times your 60 minutes because your order was in minutes, but your answer is in hours. And let's try another one. Our order is in micrograms. What's available is in milligrams. We can't work with that. Got to do a conversion. And once you do your conversion, again, doesn't matter which way you go, they just have to match. Your order is 15 because I kept it in micrograms. You could have gone to milligrams. Doesn't matter. They just have to match. I did micrograms. So 15 is the order, micrograms, times our patient weight, times 60 minutes, divided by 50,000. 500,000. I got that by converting my 500 milligrams to micrograms and then multiplying it times the volume. This answer is you got 33.75, but we've got to go to a whole number. So this is going to be 34 milliliters per hour. Okay, let's try one more of these and then we're going to move on to something else. So again, right off the bat, you notice there's no weight. Our order and our available is both in milligrams. So easy peasy, no conversion. So we're just going to do 0.5 is our order times 60 minutes divided by 450 milligrams times 250. And our answer is going to be 16.6, which is going to round to 17 milliliters per hour. Okay, I want to talk for just a minute about reading labels. So let's look at what a label looks like. And all labels look a little bit different, but I've given you a couple that we're going to look through. So first and foremost, you're going to have a concentration. And on this label, it's right here. It's in a couple of different places on this label. It's right here. This is your concentration, 125 milligrams per 5 milliliters. It's also right here, 125 per 5 milliliters. So it's in a couple of different places. It's also down here. 5 milliliters will then contain 125 milligrams. So it's in a couple of different places. Now, a lot of students will get confused because of this right here, and they'll say, oh, this is my concentration, 200 milliliters. But this is, once you reconstitute this powder into a liquid, what you have is 200 milliliters in the bottle. That's not your concentration. Your concentration is always a unit of measure in so many milliliters. And in this case, it's 125 in 5 milliliters. Now, the other thing I want to point out is if you're asked to reconstitute, the directions to reconstitute are on your label. So right here in red, add 140 milliliters of water in 2 portions. So it's 140 milliliters total, and it's water. So that's what we're putting in, and then we're shaking it. And now we've reconstituted our medication. And nurses do this. They do this every day. So if you're asked in a question to reconstitute, here are your directions right on your label. Once you reconstitute, you end up with 125 milligrams for every 5 milliliters. Okay, so let's read this label and answer this problem. So we have fentanyl 0.025 milligrams IV. And the question says, or the calculation is, calculate the correct dose to administer. So we have to pull the concentration off the label. This is what our pharmacy sent us, is this bottle or this container. We have to find the concentration. Now this one is right here, 50 micrograms in every 1 milliliter. So then this calculation is dose ordered divided by dose on hand times volume. So 0.25. So we have milligrams to micrograms, so we had to do a conversion. I went to micrograms. So 0.025 milligrams times 1,000 is 25 micrograms. So we have 25 micrograms as our order now, divided by 50 micrograms, which is our concentration, times 1, we're going to give 0.5 milliliters because this is volume. It can't be micrograms. It's volume. It has to be milliliters. Okay, let's read this label and do this one. Our prescription is 500 milligrams PO QID, which is 4 times a day. Where did I get the 1 milliliter? It was on the label. 50 micrograms per 1 milliliter. It doesn't say the number 1. You just have to know that when there's not a number, it's 1. And let's look at this medication. So 500 milligrams PO QID, which is 4 times a day. Read the label, calculate the correct dose. Each tablet contains 0.05 grams. There's your concentration. But this is, our order is in milligrams. Our tablets are in grams. Gonna have to do a conversion. So if you, again, I like to go to what's on the label or what's available. So 500 milligrams is 0.5 grams. Divided by 0.5 grams, 1 tablet. So that math was real easy once you did the conversion, right? 1 tablet. Okay, let's look at this label. So our order is for 0.375 milligrams PO every day. We're going to read the label and calculate the dose. Our concentration, you have to get off your label. I'm going to give you a minute to try to find it. Says each scored tablet contains 250 micrograms of digoxin. So my tablets are in micrograms. My order is in milligrams. I'm going to have to do a conversion. Now I have 375 micrograms ordered. That was the conversion from milligrams in my order to micrograms for my order, divided by 250 micrograms equals 1.5 tablets. Now, how do I know I can give a half of a tablet? Well, guess what it told me? Scored tablets. If your tablet is scored, you can very easily cut it in half. So I'm going to give 1.5 tablets. Okay. Let's talk about pediatric safe dose real quickly. So pediatric safe dose is where you're asked to calculate what the safe dose is for your patient. You have to be given the safe dose or you read it off the label, right? We don't have to memorize what the safe dose is for millions and millions of medications, right? Somebody's going to have to tell us what the safe dose is. The typical safe dose per kilogram. We're going to have to calculate what it is for the kid we're taking care of, but we're going to have to be told per kilogram what's safe. And so you can see it right here in this order. Usual pediatric patient dose, 25 to 50 milligrams per kilogram per day in 4 divided doses. So that's how this is supposed to be administered. 25 to 50 milligrams per kilogram per day is where your order should range. So if the question says, the question will say, what is the safe dose or is this a safe dose? So let's look at this. Our child weighs 44 pounds. Well, we know that our safe dose is in kilograms, so we can't work with 44 pounds. So the first thing we're going to do is we're going to take 44, divide it by 2.2, and now we're working with kilograms. So off the label, we read 25 to 50 milligrams per kilogram per day. This is a daily rate. So we're going to say 20 kilograms times 25 milligrams is 500. So 500 is the minimum amount of medication that we want to give for this child. 20 times 50 milligrams, that was the high end of the range, gives us 1,000. So the safe range for our patient who weighs 44 pounds is 500 to 1,000 milligrams per day. Now let's look at our order. Our doctor ordered 5 milligrams per kilogram per day PO QID. So 5 milligrams times 20 kilograms is going to give us, anybody know? 5 times 20 is going to give us 100. So what our doctor ordered is 100 milligrams per day. And look what is safe, 500 to 1,000. So is this dose safe? The answer is no, because hopefully you know that cephalexin is an antibiotic. It's just as bad to underdose your patient with an antibiotic as it is to overdose your patient, right? So this is not a therapeutic dose. So we would want to question this order. So our safe dose was 500 to 1,000 because we pulled this off the label. But when we calculated our order, 5 milligrams per kilogram is 100 milligrams per day. This is not enough medication. Okay, let's try this one. This is our same medication, cephalexin, same order, but now we're going to administer it. So the question says, how many milliliters per dose will you administer? So 5 milligrams per kilogram. Remember, our kid weighs 44 pounds. So that's 100 milligrams per day, but we're going to give it QID. And the question says, how many milliliters per dose? Your order is per day. Your answer is per dose. So the first thing we're going to do is we know we have 100 milligrams per day. 100 milligrams per day divided by 4, because that's what QID means, is 25 milligrams per dose. So now we're just doing dose ordered divided by dose on hand times volume, right? 25 milligrams is our per dose. Our concentration is 125 milligrams in 5 milliliters. We are going to give 1 milliliter per dose. Now, if I wanted to know what the daily dose was, it would be 4 milliliters, right? But that's not what it asked me. It didn't ask me for daily. It asked me for a single dose, which is 1 milliliters per dose. Okay, let's talk about some other tips and strategies. I cannot stress enough that you have to understand what the question is asking you. Is your order per day or per dose? Is what you're trying to answer per day or per dose? Are you working with minutes in your order and hours on your pump, or minutes because it's a drip rate? What are you working with? Is it asking you for infusion time? Is it asking you for milliliters per hour? What is the question asking you? Identify your rounding instructions. Remember, there are some things that you have to know because they're basic farm principles. Other times they're going to tell you round to the 10th, round to the whole number, whatever. Okay, NCLEX is going to give you a whiteboard. Use your whiteboard. Do not do calculations in your head. I have some incredibly bright students every semester that I teach math, and they make the simplest mistakes because they think, oh, I can just do it in my head. Don't do it in your head on NCLEX. Even if it's the simplest thing, just work it out and make sure you have the right answer. So use your whiteboard. Use your on-screen calculator. Again, don't do it in your head. Use your calculator. You have to know your units of measure. You have to know how to convert, and you have to know those units of measure that I gave you on that list. Double check all your calculations, and then before you hit submit, reread that question and make sure that you answered the right question. Okay, what questions do you guys have? Anybody have any questions? I'm sure you guys have had all of your questions answered in the chat box, but if there's anything I can answer, please let me know.
Dr. Bonnie, there's a question about Brianna's asking, we ignore the on hand. I think it's one of the dosage calculation problem that you were discussing earlier.
I don't know which one you're
it's
talking
about the label that you showed.
This one? Oh, sorry, let me share my screen again. you can usually not ignore on hand. I mean, we've been doing almost all of our calculations using the on hand, right? Because that's how you know what you have available. Sorry, let me share my screen again. Here we go. Okay, so is it this label you're looking at?
I believe that's the label that she was asking earlier, Dr. Bonnie.
Okay, so if you're calculating safe dose,
The pediatric safe dose.
you're not administering the medication, right? The question is only
I
asking.
think she got confused with the safe dose versus.
Yes, what is the safe dose versus, or is this a safe dose? Either way, they could ask you, versus now I want you to administer the medication. So a safe dose is just milligrams, get your unit of measure, right? In this case, it happens to be milligrams. And we're just calculating what is a safe number of milligrams for this patient that weighs 44 pounds. We're not giving it, we're just calculating, is it safe or not? Now, we are going to have to look at our order because we know what's safe from the manufacturer, but what we have to know is what our provider ordered safe. So yes, in that instance, we're not worried about the concentration because we're only dealing with, is this a safe order or not? But then the next step is to give that dose, right? Or we're going to question it. In this case, we would probably question it because it's not therapeutic. But a lot of times the next step in that problem will be, okay, let's administer it. So now we have to have the concentration right because we can't administer a medication without knowing the concentration. But yes, you're right. Safe dose, you do not need the concentration. You only need to know what the typical safe dose is per kilogram, and you have to know what your order is. Any other questions? How do we calculate?
There's also another question about, yes, the diet.
So urine, 1 milliliter of urine always equals 1 gram of fluid. That's no different than an adult, right? 1 milliliter equals 1 gram. With a diaper, you're going to subtract out the dry weight. So you have to know how much the diaper weighs without any urine in it. So a lot of times in a math problem, they'll say the dry weight of your diaper is 30 grams. And so then if your wet diaper weighs 200 grams, the first thing you have to do is subtract out the dry weight, which would be 170 grams, or 170 grams, and then you can convert that to milliliters. Yes, this PowerPoint will be in the Google Drive.
Thank you, Dr. Bonnie. And there's another question. Do we need to know IV intake and output for NCLEX?
Yeah, you could definitely be asked to calculate intake or output for sure. So intake, I'm just trying to think off the top of my head. Intake could be IV piggyback, blood, right? Anything that goes into the patient. It could be oral as well. So if you're asked to calculate input, remember you've got to have everything that, that went into the patient. It's not just what they drank. So therefore you now have to know, and this is where they'll get you, is if you don't know the conversion, it's not really a conversion, but you don't know how to convert ounces to milliliters. So 1 ounce is 30 milliliters. Then 4 ounces is 120 milliliters. 8 ounces, 240 milliliters. Okay, so if they say your patient drank 4 ounces of apple juice, that's 120 milliliters. And then your output, remember, is anything that came out of the patient. That could be liquid stool, it could be emesis, it could be urine, could be from a JP drain, it could be suctioned out of the NG tube. Anything that comes out of your patient is output. And then, of course, what we want to see is there more output than intake? Or is there more intake than output, or is it relatively balanced? I would say one of the biggest rules I think that students struggle with intake is, remember, ice is half the volume. So if you have 8 ounces of ice, it only counts as 4 ounces of volume. And then liquid is only something that's liquid at room temperature. So ice cream counts as liquid, right? Because it's liquid at room temperature. However, Jell-O is harder to calculate, right? Because it's not liquid at room temperature. Pudding might not be liquid at room temperature. So you might brush up on those little specifics about what counts for what. I know ice is a big one. Popsicles are pretty equal. I think popsicles go equal volume to milliliters, but ice is half. And then just knowing that 30 milliliters is 1 ounce. Any other questions?
They're asking for Google Drive address. I believe Dr. Bani already posted that earlier in the chat. And they're asking about the heparin.
About heparin?
Yes.
About heparin? Yeah, heparin you could definitely be tested on. I hate to push us over. I can show you heparin. Let's see. Let me pull up heparin and I'll show you the calculations for heparin. Okay, so remember heparin, your order can be, or what you could be asked for could be one of two different things. You could be asked for milliliters per hour, so that's how you're going to run it, is milliliters per hour, or they could ask you units per hour. So your formula is a little bit different depending on whether you want milliliters per hour or units per hour. So I can put this slide with the formulas in the Google Drive. I can have Dr. Henry do it tomorrow, and then I can give you some practice with heparin if you want. So again, it's just, they're going to tell you that you're working with heparin. That's easy, right? Because your doctor has going to order heparin, and then you're going to have a total. Let me show you what a problem might look like. So let's look at. There's one in here. Let's see what heparin might look like. Okay. Okay, so let's look at what heparin might look like. Let me share my screen with you. Okay, so heparin, so this is what your question might look like. So you have 1,600 units per hour of heparin have been ordered. The pharmacy sends a bag of IV fluid. Again, you have to have a concentration. This time it's just going to be a lot of units because heparin is usually a lot of units in a volume. In this case, it's 25,000 in 500. And then it's asking you what the hourly flow rate is. So if we go back to our formula, to get milliliters per hour, we take a volume of IV fluid. Let's see if I can I don't know if y'all can see this all on one page. But our volume of IV fluid was 500 milliliters. We got that from the concentration. And then we're going to divide that by the total number of units in the volume, which they gave us that. It's 25,000 units. And then we're going to multiply that times the units in the dose, which that's our order. So 1,600 units divided by time in hours. And in this case, it was 1,600 units per 1 hour. And then that will give you milliliters per hour. So those are what your calculations can look like. Conversely, they could ask you for units per hour, and the formula is just a little bit different. So I can give you guys this practice with the answers for heparin, and then I can also give you the formula. Any other questions?
One last question for tonight, Dr. Bani, about the reconstitution. Someone is asking, what's the process?
Okay, so as nurses, when we reconstitute, the act of reconstitution is that you are given powder. and you have to turn it into a liquid, right? Because we can't give powder to a patient. We have to turn it into a liquid. So let's go back and look at this label. Okay, so this is a medication that came as a powder in a bottle, but we have to give it as a liquid, whether it's oral. This happens to be an oral suspension, but it could be that it's IV or IM, but whatever. It's a powder, you have to turn it into a liquid. That's what reconstitution is. We don't get to decide what liquid we use or how much we use. We have to be told that, and it's the manufacturer that tells us that. And so that's where I was showing you. Let's see, let me go back to reconstitution. Okay, so that's where I was showing you on this label. This came as a powder. We got to turn it into a liquid. And the manufacturer says, in order to turn this powder into a liquid that you can use for your patient, you have to add 140 milliliters to this powder. And it tells you it has to be water. Now, sometimes it's sterile water. Sometimes it's just water. Sometimes it could be, I guess, D5W or normal saline, or you don't get to pick that. They're going to tell you. And then they're going to tell you exactly how much volume to put into the powder. And then you shake it or roll it, whatever it tells you to do. And then once you have turned that powder into liquid, again, that's what reconstitution means. Now you have, in this case, 125 milligrams in every 5 milliliters. Does that help?
Thank you so much, Dr. Bonnie. I don't see any more questions on my end. So thank you so much. It was a great presentation.
Thank you. Okay, guys. So I would say math. The more you practice, the better you get. Practice, practice, practice. I'll give you all the stuff in Google Drive tomorrow. Have a great night. Thanks for joining me.
Thank you.